Hi, John. I'm happy to have you here today. Today's just going to be an intake session where we get to know each other better, and everything discussed here today is completely confidential. The only time I would need to break confidentiality is if you were a threat to yourself or someone else. Throughout this session, if there's anything I can do to make you more comfortable, please just let me know. Do you mind if I use my computer throughout this session?
No.
Okay, thanks. So what brings you here today?
My girlfriend believes that I drink too much, and I got a DUI a couple months back, and she's threatening to break up with me if I don't go talk to somebody and try to get it under control.
So can you explain the night you got a DUI?
I went to the bar for a few drinks, and I was there for a few hours, and I thought I was okay to drive, and I drove home, and on the way there I got pulled over and I failed my sobriety test, and they charged me with DUI.
So how many drinks did you have? Do you remember? Can you estimate?
I probably had about 5 or 6 drinks over the course of a few hours.
Okay. Were they beer, mixed drinks, shots?
They were all mixed drinks.
Okay. Were you there by yourself or with others?
No, I was there by myself.
Do you typically go to a bar and drink by yourself?
Yeah, I mean, if I usually see somebody in there I know, but yeah, I usually go there by myself, and then if I meet a buddy there, then I'll drink with them.
How do you usually feel after you drink? Like, did you feel you were able to drive? Did you just do it out of convenience?
I guess both. I was there for a long time, I guess, so I thought that when I did drink wore off, and it was really close to home, so I didn't want to have to leave my car overnight, so I thought I was okay to drive.
Okay. And that was your first DUI?
Mm-hmm.
Okay. When was the first time you had alcohol?
Probably I was 16 years old, I think.
And did you do it socially, with family? Do you remember like the exact time?
Yeah, I was the younger of my friend group, and they started drinking, I guess. So I wanted to be, still hang out with them, so I did it too.
And have you drank ever since you were 16?
Yeah.
Okay. At first, what did you start off drinking?
Pretty much whatever my parents had in their thing or whatever we could find, mostly beer.
How often would you say you would drink beer?
It started off, on the weekends we
Mhm.
would drink and stuff at somebody's house, and then we started drinking during the week or after work and stuff like that.
Have you ever noticed a problem? Has anyone ever told you they think you have a problem with alcohol?
Yeah, I've had family reach out and some friends tell me that they think that, I can't go a full day without drinking, or when I used to work, I would sometimes drink during the day at work.
Do you have family members with a substance use disorder, an addiction?
No.
Okay. Can you describe your family for me?
I have a dad, my mom, and then I have 2 sisters and a brother.
Okay. And you said you were the youngest?
Mm-hmm.
Okay. In the beginning of the session, you said your main reason is because your girlfriend is threatening to leave you because of your drinking. How long have you been with her?
5 years.
Okay. And does she drink? Do you guys drink together, or is it just you?
She'll drink like on the holidays and things like that. Like if it's an event, she will, but not really a lot. Not as much as I do at all.
Has she specifically told you why she thinks you need to stop? Has there been any issues from it, or how has it affected your relationship with her?
She says that we can't go anywhere without me either having to bring alcohol with me or needing to have a drink. She says, it affects me not being able to work because, she thinks that I won't be able to make it through the shift without drinking and I'll get in trouble.
So, how would you describe a typical day for yourself?
I wake up, usually have a beer in the morning, and then not really working right now, in between jobs, I guess. Um, but yeah, I'll usually just hang out around, have a few drinks, and that's pretty much it.
So, you said you were in between jobs, not really working right now. Why are you in that current situation?
I used to do construction,
Mm-hmm.
and I guess I would either show up late to work, and the one time, well, it was actually a few times, I got caught drinking during the job. I guess they could smell it, and they gave me a lot of warnings, and after a while, they just fired.
Okay, so alcohol affected your job currently and previously?
Yeah.
Was construction the only job you've had?
Yeah, I never went to college,
Okay.
and yeah, it's really the place where I fit in best.
So you said you didn't go to college. Did you complete high school?
Yeah, I completed high school.
Okay, so your highest level of education is a GED?
Mm-hmm.
Okay. Next I'm gonna ask you a few questions. It might seem kind of random, but it's just to finish the intake process. There's just a few more things I have to fill in. Is that okay with you?
Mm.
Okay. It might seem repetitive also, but it's just for the form. So you described your family to me. You have a mom, dad, 3 siblings. You're the youngest.
Mm-hmm.
Where were you born?
I was born in Delaware.
Okay. And did you live there your whole life?
Mm-hmm.
Okay.
Yeah.
Where do you currently live?
I live in Pennsylvania now.
Did you experience any medical problems or serious injuries during your childhood in Delaware?
No, it was pretty much just a normal broken bones and stuff as a kid.
Did you experience any physical, sexual, emotional abuse or neglect growing up?
No, I mean, my parents weren't the most loving, but nothing awful like that.
Can you describe your childhood to me, your family, just any traditions, how it was within your household? I know you just said not very loving, so just more in depth about that if you don't mind.
My dad worked a lot.
Mm-hmm.
My mom, she was a stay-at-home mom, and I remember they would argue a lot and stuff like that. My brothers and sisters, I'm the youngest, so once they turned 18, a lot of them would, they didn't go to college either. They would go to work or something and get out of the house. They moved out, so then I remember there was a while where it was just me, and my parents would argue a lot and things like that, and they weren't really encouraging. That's why none of us really went to college.
Okay. Can you describe your religion or any cultural influences within your family? And if you still hold those practices now?
I was raised Catholic.
Okay.
We used to go to church when I was a lot younger, and then I haven't been to church and I couldn't tell you on.
Okay, so religion isn't really within your daily life anymore. Okay. No. So we talked about your education, your current employment status, your previous employment status. Do you have any concerns about money or current stressors in your life?
Yeah, like I said, I'm not working right now, and my girlfriend is, and I live with her, so I feel bad. I want to be able to help out with bills. I feel bad making her pay everything, and I want to be able to help out when I can and get her nice things.
So would you say your girlfriend is someone you turn to for support and is like a motivation within your life?
Yeah, absolutely.
Are there other things that people you turn to for support?
Yeah,
Friends, family?
Yeah, I have friends that I've had for a while too.
Have you ever talked to them about your alcohol use or job situation, or have they ever mentioned anything to you?
Um, they all tell me, try to give me advice to try to go back to school, um, to stop drinking. They even offered to go to AA classes with me, if I didn't want to be alone. But I haven't taken them up on their offers yet.
So have you ever been to an AA, NA self-help meeting or counseling of any kind for your alcohol use?
Yeah, I've been to AA, I
Okay.
think, a few times.
But by yourself, not with friends?
Yeah, by
Okay.
myself.
Do you think that worked out for you well, or is there a reason you stopped going, or do you still continue to go sometimes?
It works for a little bit.
Yeah.
When I leave there, I'll feel like I don't want to drink, and then like something will happen throughout the day or throughout the week that gets me upset. So I usually starts off like I want to have a beer to just like feel better, and then it turns into like six. And
So you don't really feel like you have control when you start drinking, or you just don't realize how much you end up drinking?
Yeah, I guess I don't really realize it
Yeah.
because they'll start as one, and then if I'm drinking with other people, you know, you don't really realize when time's going by how many you've had.
So you mentioned you drink alcohol when you feel stressed or you get upset about something. Is that what you've always done to kind of cope with something, or?
Yeah, I guess.
Okay.
Yeah, when I was younger, yeah, I'd go like sneak a beer or something like that.
So kind of just jumping around still for the intake report. You mentioned your DUI. Do you have any other current or past legal history concerns?
No.
Okay. How would you describe your current health?
I think I'm pretty healthy. I don't really work out as much as I would like to, but I don't think I'm overweight. I don't smoke cigarettes or anything like that.
So no medical concerns? No other substance use?
No.
Okay. Are you receiving any medical treatment currently for anything? Any medications? Do you have health insurance?
No, I do not.
Okay. When was the last time you went to a medical professional, like doctor, therapist, counselor?
Probably during high school.
Okay.
Would be the last time I went.
And how would you describe your current mental health?
I think it's fine. I don't really have any depression or anxiety like that I would think is like something to worry about.
Do you feel happy? Are you, like, how do you feel in a typical day?
Yeah, I usually feel happy, and then, depending on how the day goes, I can get upset by something, or, I guess, yeah, I do get stressed out a little bit about money not being able to work. Things like that, yeah, can get me upset.
So, what worries you or is negative that you think about the most? Is it just your job situation? I know you've been saying things, sorry, it's a bit repetitive, but.
I guess, yeah, the whole job thing, I know it would help my girlfriend out a lot too if I got a job. And, she's threatening to leave if I don't get help, and that stresses me out too because I want to be able to not drink, and I want to be able to work. So all those things I know stems from drinking, and that's really what stresses me out, is trying to be able to break that habit.
Yeah. So a few final things. On a scale of 1 to 10, how much do you think your drinking habits need to change? 10 being like the most.
I'd probably say like a 7 or an 8.
Okay. And would you consider it an issue for you, or just more for your girlfriend and your job situation?
It started off, just to please my girlfriend, but now that I think about it, it's pretty much the root of all my issues right now that I'm currently having.
Okay. How, another scale question, 1 through 10, how motivated are you to change? Like, are you comfortable? Would you be comfortable coming here once a week, once every 2 weeks?
Yeah, I'd be comfortable with that if it's something that's gonna help me out in my future. Yeah, absolutely.
So if you were to put that on a scale 1 to 10, what would you say you are at?
10. I would say 10.
Okay. Well, thank you for coming in. Thanks for sharing all that with me. I hope we can continue the therapeutic process together, and I will see you next week. This is my case conceptualization for the intake report I just completed with my client John. John identifies as a heterosexual male, and he is Caucasian and 30 years old. His presenting problem today was his alcohol use and how it affects his relationship with his current girlfriend. He lives with her in PA. They've been together about 5 years, and fairly recently his girlfriend did say that she would consider leaving him if he did not get help for his alcohol use. Within the past few months, John did get a DUI after leaving the bar. He considered himself fine to drive. He said he was relatively close to home. And when asking him about his drinking patterns, he did say that he usually goes to the bar and drinks alone. He's good friends with the bartender. A few of his friends meet him there. And he said that he typically doesn't realize how much he consumes when he does drink. He doesn't intentionally mean to consume that much, or it just happens that he drinks more than he thought. But when asking him about his alcohol use previously, just throughout his life, he said that he did begin drinking alcohol when he was 16 years old, starting with mixed drinks just from his house. And he has just been drinking since that. On a typical day, I asked him to describe, he said that he wakes up, has a beer in the morning, just hangs out, often has a few more drinks, and then that was pretty much it, he said. He's not currently working. He recently got fired from his job as a construction worker. He's done construction his whole life after graduating high school and completing his GED as his highest level of education. His alcohol use did affect his work and is a reason why he's not working anymore. He was given a few warnings about drinking while he was on the job or missing work because of being hungover or just from drinking, and it got to the point where he had to be let go. He said that is a major stressor in his life right now, as well as his girlfriend expressing her concerns about his alcohol use. So some background information, aside from what was just discussed, he said that he typically has about 5 drinks when he does decide that he is drinking, and it's usually over a few hours by himself. He said that there is no substance use within his family. However, alcohol use has caused a few concerns, a conflict with his parents, mom and dad, growing up. But other than that, no significant substance use that has been treated or identified within his family. His family and friends have reached out to him a few times saying that he may have a problem. They've noticed it just causing more problems within his life fairly recently. He was born and raised Catholic. He doesn't hold those practices today. He hasn't gone to church, and it's just not a part of his daily life anymore. He is between jobs right now, which I discussed is because he was let go from his job currently. He does feel bad about not working, especially with his girlfriend, considering he lives with her. Says it's a big source of stress, the relationship, his job, the DUI. His DUI was his only legal concern as of now, and previously. He has never smoked or done any other substances, drugs. It's only his alcohol use, and it's typically a beer or mixed drinks. He considers himself pretty healthy. There's no significant medical concerns. Not currently receiving any medical treatment or has not been to a medical professional like doctor or therapist since high school. No depression or anxiety. Does feel happy typically, and he said he just gets upset depending on how the day goes. That's increasing fairly recently just because of the job, girlfriend situation, and his drinking DUI situation. As far as the client's affect, he was definitely more introverted throughout the session. The beginning of the session, especially, he was pretty monotone, pretty calm, I would say. Maybe a little uncomfortable. It felt like he was fidgeting with his phone, looking at his phone sometimes, but I do think that it did improve throughout the session as it continued on. The more we talked with each other, we were able to make more eye contact, and it seemed like he was able to just be more invested in the conversation. He had no problem with being open, self-disclosing, so that was really great. He does seem very motivated. When asking him on a scale of 1 to 10 how motivated he was, he said it was a 10, and he's ready to continue therapeutic sessions and whatever it takes. He did say that initially was for his girlfriend. However, now he's realizing that his alcohol use could be the root of more problems with him. So he is completely 10 out of 10 motivated. I would say a goal for me throughout our sessions is just to be able to continue to establish rapport with him and get to know each other more, see or focus on his drinking and how it affects him and his relationships and what we can do to treat that. He has been to AA before and doesn't go anymore. He said it does work, but he just stopped going. So we'll look into that, him going to AA more voluntarily, hopefully. Maybe bring his girlfriend with him, family members, friends that suggested they would go with him or offer they would go with him. That will definitely be a goal throughout our therapy together. As well as possibly having his girlfriend come in for a few sessions moving forward. I think it could benefit the relationship throughout the process, and she can see his progress if she doesn't attend AA with him or if she does. And just, yeah, so he said he was about a 7 and 8 on a scale of 10 for how much he does think his drinking is a problem and how much he does think it needs to change. But again, a 10 out of 10 for how motivated he is to change that. So I think there will be some great progress as we continue. And that's my case conceptualization.